pre-existing conditions. That's why I mentioned that we need to have this risk adjustment bonus that would go to high-cost and low-income families to supplement tax credits and Medicaid funds. In other words, if someone had a pre-existing condition, they cannot get an insurance policy, then we would have to look at them on an individual basis, or if they had a chronic disease, and say, we're going to provide you with additional funds so that you can afford a health insurance policy. And I have no doubt, sir, about that that's going to be probably the most expensive part of my proposal. But I think it's part of our obligation. And I think over time, with people shifting this from the employer to the employee, and the responsibility there is very important and will result in cost savings. I think many of the other proposals that I made will result in lowering costs. You know, this business of shifting from the employer to the employee. Ronald Reagan once said, nobody ever washed a rental car. And you know, when you think about that, it's true. And so if the responsibility and the copay is in your hands rather than somebody else paying it, then obviously we are much more careful with how we make use of the insurance that we have. But we're going to have to address that, sir, and it's going to be expensive, but in my view, to take care of those individual cases is probably the best way to accomplish that. Yes, sir. Yes, sir. Good chair.
You had mentioned that we should be rewarding good behavior and good results. My one concern about that is that we tend to cherry pick if you get rewarded for good behavior and good results. We don't want the non-compliant patients who are overweight that don't follow their diet or have poorly controlled diabetes, because they're going to make us look bad. How would you address that type of issue?
Well, I would, first of all, encourage health insurance companies to give lower premiums to those individuals and families that practice wellness and fitness, that there's an actual financial reward for people who are members of health clubs, people who do take certain measures, that they can show the insurance companies that they practice healthy lifestyles. So I would say it would be incentive-based and reward-based rather than penalty-based for those who don't. See my point? Yes, sir.
Yes, sir. I was just wondering what your position would be on the retail advertising of prescription drugs. It seems like you can't watch TV for 30 minutes without finding half a dozen ads for this drug or that.
As you know, Sun City, Arizona was the first place in America where there was an age limit set for residency. And it's been an interesting experience. And it started in the late 1950s and 60s, and it's interesting because the studies now that are going on as this group of Americans has grown older has been very, very interesting. And my friends who are doctors involved in geriatric care tell me that they can tell by their patients' demand for certain or requests for certain drugs by what has been on television. I think that our senior citizens are probably the best informed and best and more aware people, but I think we need to do a better job of educating people that the best path that we can pursue is not to seek additional drugs unless our doctor and our provider says that it is absolutely necessary. But at the same time, I can't prevent any kind of advertising going on. I am as worried, frankly, as I mentioned before, about the present generation of young Americans and this rise in obesity and high blood pressure and diabetes that should be of great concern to all of us, because if that continues, then obviously it's terrible for America and individuals, but it's even worse in its implications for our health care costs. With that, yes, sir. One of us. One more. This is one of the staffers I was mentioning that caused me to be late. His name is Mark Braden. He's work release program. So if you have any complaints, please direct me. Yes, sir. Yes, ma'am.
Speak to the same stem cell.
Yes, ma'am. On the issue of stem cell research, it's a very tough issue for those of us who are pro-life. And I'm pro-life and have been that way for 24 years. I have a unchanging record of voting for the rights of the unborn. And I've done a lot of thought and a lot of talking and a lot of consultation and reading and prayer about this issue. And I have at the end of all that come down in favor of stem cell research. I believe that the Bible also tells us to heal the sick. And I believe that stem cell research has potential that is incredible for addressing some of the most terrible diseases that afflict our society, Parkinson's, Alzheimer's, and others. So, and I would remind some of my friends that these embryos are either going to be kept frozen in perpetuity or they're going to be discarded. And I understand the other side of the argument for those who oppose it on the principle of respect for human life, and I understand that. I hope that technology will advance far enough that we can make this a moot subject, but in the meantime, I believe that stem cell research holds such promise for a cure of some of the most terrible diseases that afflict us that I support it. I hope that if you disagree, you'll understand at least my reasoning for reaching the conclusion that I have reached, and if you oppose my position, I hope that you will respect mine, because I certainly respect yours. With that, I would like to say it's great to be back in Iowa again and again. I did attend the Iowa State Fair again this year, where I met the 1,203-pound pig. Talk about obesity problems. I did enjoy a pork chop on a stick, followed by a deep fried Twinkie. So I want to thank all of you for your participation here on this compelling issue of health care, but I also want to thank you for your participation in the Iowa caucuses. I would just remind you that the people of Iowa take these responsibilities seriously. And I would also remind you that since 1980, the person who has won two of the first three primaries, either Iowa, New Hampshire, or South Carolina, has been the nominee for the President of the United States. So I know you take your responsibilities very seriously. Obviously, I seek your consideration, but whether that happens or not, I know that you will go through this process of examination of the candidates, and please remember the words of the late Mayor Daley, who said, vote early and vote often.